Bansang Hospital is not only the second oldest and the second largest in the country. It is one which serves almost three regions, including the Upper River region, the Lower River region, and the Central River region, where it is located here in the settlement of Bansang. Over the years, it has been working in tandem with other organizers, including partners from within and outside the country. Well, that is what is happening here right now. As we understand, they are working in association with the International Humanitarian Relief Organization in as much as an operation for cataract patients is concerned. Well, I have with me Mr. Bakari Diba, who is the key resource person responsible for the operation.
It's a pleasure for us to have work with the International Humanitarian Relief Organization. These are a group of people. They are from Holland and some of them are from Turkey. Over the years, they have been doing some certain activities for communities like digging walls. But this year around, they came and found it necessary that they should also engage in the health sector. As we all know, cataract is the leading cause of blindness, and then they want to help the poor people so that they can have operation, because sometimes people have cataract blindly unnecessarily. They are at home, but because of the fee attached, some of them find it very difficult to pay for their fees. So they came in so that they'll operate 100 patients free of charge. With my colleagues, we were able to do 35.
You still have 65 more to do. How has it been? How were you able to mobilize and get all these people who are affected with cataract to come up?
We use the radio stations, community radio stations, like the one in Brikama and the one in Bansang, to do a community sensitization that those with visual problems should report to Bansang Hospital on a certain date. And then when they came, we did a community screening where those with cataract were identified and then given numbers. Ask them to come. Like the first group came yesterday, so each day is a group, so that we'll get our 100.
We will just talk to some of the people to see what they make of this intervention. Mamadi Mane Fuladu Chakunda.
Nchafono banko bele nyab elo choto. Yonim atelinga wo chi pal choto meli alonko ibolu topotola wo muntele kontani kubalati pokal so duala.
Babukar Kante, resident of Brikamaba, as we understand, you are also part and parcel of this cataract operation project, which is going on here at the Bansang Hospital. Can you please share a little bit of that experience?
I'm very, very fully happy, because if this thing continues, most of the Gambians will work for a long time without blind. We have 100 people at one time, and up to now people are coming. But if at all it's not free, I'm quite sure that most of us will not come. But for that purpose, we are still behind you people and the Gambia government, and then the guests whom we know they are here. We thank them very well.
Mr. Bakari Diba, again on the hospital's interaction and cooperation with partners and stakeholders, both within and outside the country. What can you further comment on that?
Most of the time you listen to the radios and television, you will hear philanthropists helping RVTH, Serekunda hospitals. We want them to come on board. Bansang Hospital is very far from the coast, and sometimes access to some of these things becomes a problem. I think they should also look inward in the hinterland so that they can come and help. CRR and RRR are one of the poorest regions in the country. So if people can come on board, help people who are in need, I think it's a very welcome idea.
Modou Bajan reporting from Bansang, CRR.